Well, if you need cosmetic or reconstructive eyelid surgery, the most important thing is finding the most experienced and well-trained surgeon. Dr. Geoffrey Kwitko has been specializing in eyelid surgery in Tampa for almost 30 years, and he joins us now. Good to have you here.
Thanks for having me.
You are an oculoplastic surgeon. Explain for us what that means.
Well, primarily I'm an ophthalmologist, an MD for the eyes, and then I did special training after that, specializing in plastic surgery around the eyes and orbital surgery, which is the bony cavity the eye sits in, as well as neuro-ophthalmic surgery, which is the disease and treatment of optic nerve diseases.
Let's talk about thyroid disease and how that affects the eyes.
Well, thyroid disease affects the body in total. However, it has specific effects on the eyes. There's an autoimmune reaction that's set up that causes the muscles around the eyes to swell. And the problems range from just simple dry symptoms such as irritation, gritty, sandy, tearing, blurred vision, redness, and can progress all the way up to actual blindness if the muscles around the eye swell enough to squish the optic nerve.
There's a before shot right there.
Right. You can see one of the earliest symptoms is lid retraction. The upper lids get pulled up a little too high, and the lower lids get pulled up a little bit too low. The eyes dry out, the patient has trouble closing their eyes, they tend to sleep with their eyes open, and it causes a lot of discomfort, irritation, redness, blurred vision. And these are pretty straightforward to treat. We just realign the eyelids, drop the upper ones, raise the lower ones so that the cornea is covered properly and they can close their eyes. And that goes a long way towards, number one, increasing the function so their eyes don't hurt them all the time and their dryness is better. And cosmetically, they don't look like they have a stare, that bug-eyed look.
Well, speaking of cosmetically, let's talk about eyelid surgery.
Okay.
A lot of people getting that done.
A lot are,
For
yes.
various reasons.
And more men these days, too, I may add.
This is true.
Yes.
So take us through the process of that. We're going to look at a before shot here, and you can explain what we're looking at. And a lot of people have the hooded kind of look to their eyelids.
Correct. What happens is the eyelids, they get saggy, fat comes forward, and they get that hooded look both in the upper and lower lids. And if you look at the before and after, you can see that the after picture is a much more refreshed. The eyes are open, they look more alert, they're not as tired. And the key to it really is to do the surgery to the point where they don't look like they've had plastic surgery.
Right.
You want them to look like they did maybe 20, 30 years ago, their normal look that they had when they were younger, but you don't want them to look artificial. So you want to avoid too much hollowing in the upper lids and lower lids by taking out too much fat. So you want it to be subtle, and the most important thing also is to make sure that you don't take out too much skin, and then they don't close their eyes.
Right.
And if you do that and the patient can't close their eyes, they end up with the symptoms of dryness, irritation, and they're in agony. So you really need to be careful. You don't want to take too much. You want it to look refreshed. You don't want it to look artificial. Bear in mind that the eyelids were there for a purpose, and you want to make sure that they can still do their function.
And lastly, a non-healing eyelid lesion. What can that mean?
Well, any lesions that don't heal, you need to make sure it's not a skin cancer. Skin cancers are very common on the eyelids. The most common is a basal cell cancer, which if you're going to get a cancer, that's the one you want because it won't spread to other parts of the body. It's treated by removing it. The key with basal cell, like any other disease or cancer, is to catch it early. The smaller it is, the easier it is to remove, and the easier it is to reconstruct.
Okay. Well, a big thank you to you, Doctor. For more information, you can call Dr. Kwitko's office at 813-877-8665 or log on to his website. It is kwitko.com, and we will have all this information on daytimeonline.tv. Thank you again for coming in.
Thanks for having me.
We'll be right back.